April 3, 2025. The time is 7:44 p.m. Today I wanted to talk about Retatrutide. I took my first dose after 4 weeks of 2.5 milligrams of Tirzepatide. I began a month ago at approximately 183 pounds, and I'm currently 175 pounds. The effects of the Tirzepatide is still very present. It can be described as, in my case, a sense of fullness and reflux, perhaps not nausea, but absolutely no interest in eating further after my one meal a day. I'm taking usually between 2 and 5 p.m. or so. To the point where I almost have to force myself to eat. When I do, I feel extremely disgusted, full, almost borderline nauseated. The nausea symptoms have not been severe for me. Reflux symptoms are more pronounced than nausea. Sometimes some sense of dry mouth, sense of slowed bowel emptying. Overall, I believe I'm tolerating the dose of 2.5 milligrams. Some research and reading, I've decided to move on to Retatrutide, which seems to have many benefits over Tirzepatide. Most people have seen this very well-respected publication by a Yale researcher. They published last year this summary of the phase 2 trial for Retatrutide involving 338 adults, showing a marked dose effect. And at the highest dose, 24.2% of their initial body weight was lost after 48 weeks. At whatever dose, where you feel the effect of reflux, nausea, or whatever it takes to make you not eat in excess, is the dose that you need to be on. You don't need to escalate the dose to 12 milligrams, because that would only increase your adverse effects without any additional advantage. So if you feel the effects and it is enough to suppress your appetite at 1 milligram, that's where you should stop. I believe that's the way you should be looking at this. This is a summary of the beneficial aspects of Retatrutide: control of diabetes, obesity, and a very pronounced reduction in liver fat, what they call hepatic steatosis, with a very respectable safety profile, comparable to Tirzepatide and semaglutide, also known as Ozempic, which allowed 78% of the participants to follow through on the study. I'm switching from Tirzepatide to Retatrutide, knowing that I'm taking on many risks beyond what these clinical trial participants took. And what I'm doing would be seen as foolish by, I think, most people. Number one, I'm using a peptide source from Polaris, which is an uncertified, unregulated, mostly unknown and unnamed source. I do know the two business owners. I guess I decided to trust them. Secondly, I'm using an agent that has not passed phase 3 clinical trials, the safety portions of the clinical trials. You have to pass through 3 phases of clinical trials to deem it to be safe enough to be submitted to the FDA for approval. So it's not been FDA approved. Very foolish. Next, I'm using an agent in the very early use history. Usually, the wise thing to do would be, after a drug passes phase 3 clinical trials and is FDA approved, to wait about a decade of widespread public use, because this is what's required to pick up what they call latent or small signals of adverse effects. This is how many drugs were later canceled. They didn't know that certain NSAIDs caused or seemed to increase heart attacks. They didn't know that using Premarin's may increase breast cancer, stuff like that. It was only seen in small signals after widespread public use. Now I'm disregarding all that and proceeding onwards foolishly. So this is very foolish and premature thing to do, but I decided to do this because A, I am 58 years old, so statistically I'm more than 2/3 done with my life, with my expected life expectancy of 75, 85 years. Secondly, I have several health issues that will not tolerate another decade or two of waiting for safety signals from this product. I had pre-diabetes with an A1C as high as 7.1 at one time. I was on borderline obese. I was hypertensive. I had 3 back surgeries. I mean, I would not be expected to live long-standing had I waited. That was my considerations for having started this. I think being overweight in itself alone dramatically reduces your quality of life so much that, in terms of health, psychology, social aspects, you can make a strong argument to take this. So far, I've been encouraged by the findings, the safety signals from Ozempic usage, widespread usage now, as well as zepbound mounjaro, which is Tirzepatide. And that's why I proceeded on to using Retatrutide. I'm encouraged by its mechanism of action, delineated in animal and human studies, and it seems to correlate closely with efficacy and safety and adverse effects. 2024 New England Journal study was very encouraging. Other things that got out in the press, like it may cause medullary thyroid cancer and pancreatitis and breast cancer, those turned out to be, further analysis, very unlikely. Only in rare people with MEN syndromes, and the same with pancreatitis. It was probably, that data may have been dirtied by people who have other risk factors to have pancreatitis. So I think overall this drug is so far safe. When you compare Retatrutide with Zepbound and with Ozempic, again, very encouraging. So I used this chart to decide on using 3 milligrams based on my tolerance at 2.5 and efficacy at 2.5 of Tirzepatide. So based on this, now the greatest reason to choose Retatrutide over Tirzepatide or Ozempic, however, are all the other side effects besides the class effect. These are the class effects. Suppresses appetite by disrupting the arcuate nucleus, paraventricular, and dorsomedial, dorsoventral hypothalamic reflex arc that causes habituation, homeostasis, and compensations to weight loss. It disrupts that. It reduces hepatic steatosis, improves, therefore, your circulating lipids. I believe it will reduce your visceral fat accumulation in your body. It has been shown to reduce protein loss in the kidneys. It decreases your blood pressure or helps hypertension, increases microvascular coronary artery flow, reduces plaque and inflammation formation, reducing heart attacks, overall improving cardiovascular risk profile, and most significantly improves or decreases cardiac apoptosis, likelihood of heart cells to spontaneously die. Next slide illustrates some of the very interesting aspects of Retatrutide. The main thing that differentiates Retatrutide from the others is this, of course, glucagon addition, which increases energy expenditure, and from the results standpoint, seems to cause lipolysis, preventing fat accumulation everywhere, especially liver, viscera. At the very top, you see on the top right brain aspect, decreasing appetite, seems to increase memory formation. Very interesting. I mentioned the lipolysis in the next panel. I mentioned the increase in cardiac output, decreased apoptosis. This would theoretically increase your lifespan, increase your heart lifespan. And the things that glucagon does increase glycogenolysis, lipolysis. It works at the skeletal muscle level. There was a whole chapter written in a book talking about how this agent increases osteoclast and osteoblastic activity. This is bone formation, reducing bone resorption. So this theoretically will help like women with osteoporosis or anyone with osteoporosis. You know that the predominant side effect is the slowed gut motility that I'm noticing, the reflux. It seems to decrease acid secretion, which is very beneficial to people with reflux like me. I occasionally take protonics or Pepsid or agents like that. Hyperacidity symptoms. I get spasms from it actually. And this has the potential of helping that. We all know about the anti-diabetogenic benefits of this agent, so I won't cover that part. And so these are all the reasons why I switched to Retatrutide. There's a study, a trial ongoing right now to help NASH patients, which is non-alcoholic steatohepatitis. A very difficult problem, very hard to treat. And this agent has the potential of helping these people. I think it also will reduce visceral fat accumulation, like I mentioned. This is very good stuff. Almost like too good to be true. The last part I wanted to look at is looking at the central pathways of the GLP-GIP glucagon agent, the triple agent. This is how sustained weight loss is created. Normally, the arcuate nucleus, as you can see there, is located near the anatomical rear wall of the hypothalamus. It is the central node affecting your metabolism, homeostasis, and the balance of your appetites, including the control over your psychosomatic hormonal actions from leptins, ghrelins, insulins. Normally, as a survival mechanism, when your weight starts dropping, your body's metabolism slows down in compensation to maintain your body weight and fat stores in times of stress. It is a survival mechanism. These GLP agonists, especially the retatrutide, will circumvent this compensation at the arcuate nucleus to the dorsomedial and paraventricular hypothalamic nucleus reflex arcs. And therefore, you will stay full and of low appetite, even when you've lost dramatic amounts of weight, 20 to 30% of your body weight, which is what the trials have shown. So, for instance, someone who was weighing like 200 pounds should demonstrate a slowed metabolism after you lose down to 160 pounds. But these agents will prevent you from doing that. Your metabolism will stay robust and full, as if no weight has been lost at all. Eventually, you have to therefore taper off these medications to cease this weight loss, because you will become eventually anorexic and unhealthy. So one of the adverse effects of these agents is that it works potentially too well. So I think I'm still concerned about the rare signals that it will spray out when the mass public uses it, and I will need to surveillance it. But I'm willing to accept all these risks given these potential benefits. So I spent like $1,041 shipped text for my supply of 7 vials of 15 milligrams of retatrutide, which should last me about a year almost. And I will use up the remainder of my Tirzepatide to taper down off of it. Eventually try to get myself off of these agents after a year, at which point I may have lost adequate weight, and I will try to challenge myself to have discipline enough to not regain my weight back. That's my plan for the oncoming year. I'll have to talk more about the effects of retatrutide maybe a few months out.